get started then. So just go ahead and draw in your midline. Okay, and let's go ahead and put in cranial nerve number 9. We talked before, cranial nerve number 9 is going to be right here. It's going to be the first one in the medulla. Alright, and cranial nerve. There's your cranial nerve as it exits the medulla. And again, this is cranial nerve number 9. And that's going to be your glossopharyngeal. Okay? Ninth cranial nerve, glossopharyngeal. Okay, can somebody give me a function for cranial nerve number 9? Posterior 1/3 of the tongue for general sensory or taste? The blue one. Okay, let's do the blue one. Let's go ahead and do general sensory. Good answer. So if I draw in, so what nucleus is going to be responsible for general sensory for all the face? Does anybody remember? It's going to be the main sensory and spinal nucleus of trigeminal. Okay, so that looks like this. Goes all the way down. So remember, there are two different nuclei, but they function together. So this is main sensory and spinal nucleus of trigeminal. Okay, we have a general sensation. So let's go ahead and say general sensation. This is just cranial nerve number 9 from the posterior 1/3 of the tongue. Okay, and cranial nerve number 9 has another general sensory. Does anybody remember the other general sensory for cranial nerve number 9? It's to do with the ear. External canal is 7. Number 9 is next. What's next? Middle ear. So general sensory for the middle ear. Okay?
What does it say at the top circle? Main sensory?
Main sensory and spinal nucleus. Yeah. So your main central nucleus and the spinal nucleus are trigeminal. Okay, those are going to be the main sensory nucleus.
Trigeminal?
Trigeminal?
What does it mean again?
Trigeminal is your 5th cranial nerve. Okay? So it's just going to use... I'll even put that in if you forgot. Okay? And then another sensory function for cranial nerve number 9. You having trouble seeing something, Johnny? What you need?
Yeah, what did you just write under?
Of trigeminal. Paul had forgotten that. So it's the main sensory nucleus of trigeminal and the spinal nucleus of trigeminal that we talked about last week. So that's just the name of these nuclei. That's what they're called. Does anybody remember another sensory function, general sensory function for cranial nerve number 9? Yeah, naso and oral pharynx. Correct. Okay. Everybody got it? So that general sensory information, just like the other cranial nerves that we looked at last week, that general sensory information is going to come in, travel through the 9th cranial nerve, and synapse in either the spinal or main sensory nucleus of trigeminal. This is general sensory information from somewhere in the face. Yes, Chris?
Can you just repeat what's that?
Middle ear. Yeah, and that's your naso and oral pharynx. Those are just the general sensory functions for cranial nerve number 9. It's really just a few you have to be aware of. It's general sensation from the posterior 1/3 of the tongue, general sensation from the middle ear, and general sensation from your naso and oral pharynx. Pharynx is next step down after your tongue. Okay? Okay, and that general sensory information comes in, travels through as axons through as cranial nerve number 9, synapses, and that nucleus. Give me another function for cranial nerve number 9. Anybody? Taste, for posterior 1/3 of the tongue. And since it's taste, what nucleus does it use? Anybody remember what nucleus taste comes from? The solitary nucleus, that's right. So let's go ahead and draw in our solitary nucleus down here. Okay, your solitary nucleus. It's going to be purple. Alright, so solitary nucleus is just general taste. And you said that cranial nerve number 9 is responsible for taste from the posterior 1/3 of the tongue. Okay, so that sensory information is going to travel as axons, part of the 9th cranial nerve, and synapse to deliver that sensory information into the solitary nucleus about taste from the posterior 1/3 of the tongue. Another thing that cranial nerve 9 does through the solitary nucleus. Does anybody remember? Carotid body, great. So that's going to be carotid body innervation. Okay. Information traveling from the carotid body, sensory information travels as part of cranial nerve number 9, synapses into the solitary nucleus. Awesome. Questions about this? Just like all the others, but cranial nerve number 9 has a lot of different functions. There's still a couple that we need to talk about. Can somebody tell me another function for cranial nerve number 9? Sorry. Parotid. Yes, the parotid gland. Okay, and the parotid gland is innervated by cranial nerve number 9, and it uses a nucleus that's situated about here. And that's going to be the inferior salivatory nucleus. Okay, so your inferior salivatory nucleus. And that is the parotid gland. Going to be one of the salivary glands innervated by cranial nerve number 9. So there's going to be neuronal cell body here in the inferior salivatory nucleus. Sends out axons as part of cranial nerve number 9 that provide innervation to the parotid gland for salivary production. One more small motor function for cranial nerve number 9. Does anybody remember what that one is? Stylopharyngeal muscles, correct. And innervation of stylopharyngeal muscles happens through this nucleus. It doesn't know who he belongs to. That's going to be your nucleus ambiguous. Used by both cranial nerve 9 and 10. Nucleus ambiguous. And that's that small muscle involved in swallowing. It's called your stylopharyngeal Stylopharyngeal. Okay. Stylopharyngeal muscle. Okay, so in nucleus ambiguous, there's a neuronal cell body. That neuronal cell body sends out axons that travel as part of cranial nerve number 9, and these axons provide innervation to the stylopharyngeal muscle. That's all of cranial nerve number 9. Questions about cranial nerve number 9, glossopharyngeal? Lots of different muscle functions, or lots of different nerve functions, all accomplished by using different nuclei in the brainstem, mostly sensory, just a little bit of motor. Okay. All right, let's move on to cranial nerve 10 and 12. Same section. This is going to be your pons. This is going to be your medulla. Just to make it easy to see, I'm going to put midline in here. And again, just like before, I'm only going to draw the cranial nerve on one side. Take a little bit more. So cranial nerve number 10. It's going to be positioned just below cranial nerve number 9. It's going to exit here, approximately. Draw that. Okay, cranial nerve 10 is vagus. Vagus nerve. It's a hot topic these days. I went to the, I don't know if anyone from the first year cohort went, there was a VPTA conference on Saturday in Richmond, Virginia, that a few of us went to. I know I saw a few second years there. But the vagus nerve or vagal tone is a really hot topic for research these days, and also important in something known as functional neurologic disorder. It used to be called a conversion disorder. In other words, a lot of people thought that patients were faking the problem because there wasn't any sign of the problem. But actually it's not. It has to do with prolonged stress over time. And one of the treatments is going to be decreasing vagal tone overall. So just an aside, information for you. Can somebody give me a function for cranial nerve number 10? General sensory of larynx and epiglottis. Very good. Okay, so if it's general sensory, which nucleus does it go through? This big one, the blue one, right? The main sensory and spinal nucleus of trigeminal. Okay, let's write that in there. That's the main sensory nucleus of trigeminal. Remember I said these two function together, so really no distinction. And the spinal nucleus of trigeminal. Okay, so we have general sensation. The cranial nerve number 10 has just a small piece of sensory, and it's general sensation from the larynx, Y and X, and epiglottis. Okay, so that means you can feel it. Okay, so general sensation from the larynx and epiglottis travels as axons through cranial nerve number 10, and since it's general sensory, it's synapses here in the main sensory and or spinal nucleus of trigeminal. Somebody give me another function for cranial nerve number 10. Yeah. Muscles of the soft, so the motor function of cranial nerve number 10 is going to be muscles of the soft palate. So to do the motor function, cranial nerve number 10 is going to be using that nucleus that belongs to both 9 and 10. That's your nucleus ambiguous. There's your nucleus ambiguous. Okay, and this is going to be motor function, so it's red. So muscles of the soft palate, larynx, and pharynx. Okay, so neuronal cell body present in nucleus ambiguous sends out axons traveling as part of the vagus nerve that go on to innervate muscles of the soft palate, larynx, and pharynx. Somebody give me another function for cranial nerve number 10? A couple more we talked about. Say, I heard somebody.
Parasympathetic innervation of the heart.
Yep, parasympathetic innervation for the heart, lungs, and GI, and that's going to be green. Okay, to accomplish parasympathetic innervation of the heart, lungs, and GI, it's going to use this nucleus, and this is going to be your dorsal motor nucleus. Okay, so this is parasympathetic. For heart, lungs, and GI system. Okay, remember that's one of those autonomic functions. And there's a neuronal cell body that lives in the dorsal motor nucleus. And it sends out axons that travel as part of the 10th cranial nerve and provide parasympathetic innervations to the heart, lungs, and GI tract. Anybody else want to give me another function for cranial nerve 10? Vagus? Taste. Right. Since it's taste, which nucleus does it use? Solitary. Perfect. So here's going to be your solitary nucleus down here in the medulla. So that's your solitary nucleus. Solitary nucleus. So as far as taste is concerned, it's taste from the base of the tongue and epiglottis. From the base of the tongue and the epiglottis. Sensory information is going to travel as part of the 10th cranial nerve. And synapse here in the solitary nucleus. There's one more function for cranial nerve number 10. It's going to use the solitary nucleus, but it doesn't really have to do with taste as much as some sort of sensory. You remember? It's different, huh?
Visceral.
Yeah, the visceral sensation. Great. So this is going to be visceral sensation from heart, lungs, and GI. so your visceral sensation from heart, lungs, and GI tract travels as part of cranial nerve 10. And that sensory information comes in as part of cranial nerve 10 and synapses here in the solitary nucleus. And cranial nerve number 9, mostly sensory. Cranial nerve number 10, mostly motor. Okay, they use a lot of the same nuclei. Questions about cranial nerve number 10? Yes, Johnny, go ahead.
I'm just a little confused on how it's mostly motor when it seems like there's more sensory. I mean, like, how do you know that it's, I don't know.
That's
I don't
okay.
really know what I'm trying to ask. If it's like,
That's okay. So parasympathetic innervation is considered motor. Okay, so that's heart, lungs, and GI. It's a lot of territory. And then you also have all the muscles of the soft palate, okay, and the pharynx and larynx. So that's going to be
just covers
motor,
area.
larger, a lot of motor, a lot of muscles involved, and a lot of area involved. Okay, but the sensory function is going to be just taste from the base of the tongue, which is, that's actually kind of long. Base of the tongue and that little bit of the epiglottis, okay, and also considered sensory is going to be that visceral sensation. Okay, so but in general, cranial nerve 9 is more sensory, cranial 10 is more motor. Does that help to answer your question? Okay, any other questions about 9 or 10? Those are the hardest ones. I mean, they have a lot of different functions coming from all over, but I really feel like if you know the colors, you're good, right? Hopefully you can associate your color with a function. That way you know, as long as you know the function of the cranial nerve, you know which nucleus it's using. All right. Okay, last cranial nerve that we're going to talk about as far as nucleus is concerned is a really simple one. This is going to be, oops, wrong marker. I'll put it on this side. So this side's cranial nerve number 10. On this side, I'm going to do this one that we talked about coming out of the pre-olivary sulcus. Okay. This one's the one that innervates tongue muscles. Does anybody remember the name?
Hypoglossal.
Hypoglossal. Correct. This is going to be your, whoops. This is cranial nerve 12, and that's your hypoglossal. Yes.
Are we not talking about the spinal accessory, like where the SCM?
So the good question, but the spinal accessory, remember, comes from the ventral great horns of cervical vertebrae, C1 through C5. So it doesn't have a nucleus that's in the brainstem. No, cranial nerves number 1 and 2. Remember, that's going to be your optic is number 2 and your olfactory is number 1. So they don't have nuclei either.
Okay, so that's just three.
Those three do not have nuclei as part of the brainstem proper. You're welcome. Any other questions about this? Yeah, the last one we're going to talk about that has a nucleus proper in the medulla is going to be your hypoglossal. And the hypoglossal, really simple, right? Has one nucleus that we have to worry about. It's motor, so we're just going to put it right here. It's the great big old one that travels through. It's going to be your hypoglossal nucleus. Okay, with your hypoglossal nucleus, neuronal cell bodies that are part of the hypoglossal nucleus sends out axons that travel through the 12th cranial nerve, and their main job in life is to innervate tongue muscles. So the voluntary motion of tongue muscles. Good. Is that okay? Simple one. Got to end with an easy one. Any questions about this? So hopefully you guys were able to see where the cranial nerves are. 4 above the pons, 4 in the pons, and then 4 below the pons, right? all these cranial nerves, some of them have their own nuclei, some of them share nuclei, right? But as long as you know the function, you should be able to associate the function of the cranial nerve with a specific nucleus. Yes? Yeah? Okay. Let's go ahead and move on then. That's the cranial nerve. Let's talk about the sensory pathway for cranial nerves. I guess you can think sensory pathway or sensory tracts. I like to equate this to the SCT or spinothalamic tract. If you think in that way, I think it's a little bit helpful because the pathways are similar. Only this is going to be the pathway that the cranial nerve sensory information takes. Everybody with me? Sensory cranial nerves? Okay, sensory cranial nerve pathway. I had talked previously, when I covered the trigeminal, the fifth cranial nerve, and we talked about the sensory. Remember I talked about the trigeminal ganglion? The trigeminal ganglion is something that exists in your temple on the side, and that's very similar if you want to equate it to a dorsal root ganglion. Okay, so I'll draw that here. And this is just my trigeminal ganglion. Like a dorsal root ganglia without the spinal cord attached. Right? It's just going to be the purpose of the trigeminal ganglion to house that first order sensory neuron. So here you have your neuronal cell body, stalk coming off. And we also talked about the trigeminal ganglion as having three different divisions. You're going to have division 1, which is your ophthalmic. Right? Then division 2, which is your maxillary. And then division 3 is going to be your mandibular. We talked about that before as part of the trigeminal sensory system. Okay, so remember, Johnny, do you have a question?
Sorry, is it V1?
Yeah, 5, 1, yeah. So cranial nerve number 5, trigeminal, 1. 3 different divisions of the trigeminal. The main sensory nerve for your face, ophthalmic, maxillary, and mandibular. Okay, 3 different divisions. And if you go back and look at it, we looked at different colors for the face for the 3 divisions. Any other questions about where we are? I'm using the trigeminal as just an example. The majority of the sensory cranial nerves will have their own ganglion, but this is an example using the trigeminal. Okay, really easy to see. All right, now, since we have trigeminal coming in and we're talking about general sensation of the face, what nucleus do you think we're going to use? Yeah, main sensory and spinal nucleus of trigeminal. Very good. Okay, so let's go ahead and draw that in here. This is going to be your main sensory and spinal nucleus of trigeminal. Whoops. Everybody with me? Okay. And just like all the other sensory pathways that we looked at, this one's going to decussate. So we're going to go ahead and put in our midline. And hopefully everybody can recognize this as my thalamus. And this is going to be part of that basal ganglia that we talked about, that putamen, GPE, GPI, that's going to be collectively your lentiform nucleus. Okay. questions where we are? Okay, great. So, sensory information coming from the first order neuron in the trigeminal ganglion, or coming from the area of the face, V1, V2, V3, for trigeminal, is going to enter in as which cranial nerve? General sensory of the face? Which cranial nerve is general sensory of the face? Not facial. Trigeminal, yeah. So this is going to be my trigeminal nerve right here. So this is cranial nerve number 5, trigeminal. So its motor function for the face, that's 7. Trigeminal is going to be sensory function. So this is cranial nerve 5. Okay. So that information, sensory information from the face, is received through the first order neuron that resides in the trigeminal ganglion. That sends axons in as part of the 5th cranial nerve, and synapses here in the main sensory and spinal nucleus of trigeminal. Okay, let's see if I can make that. Yeah, I'll make that a brown color so it's really clear. So this this neuronal cell body, that first order neuron synapses, no surprises, this is your second order neuron. That's your second order neuronal cell body, second order neuron. Your second order neuron resides in the main sensory or spinal nucleus of trigeminal. Okay. And since it's a second order neuron, what do you think it does? Decussates. Excellent. So this second order neuron sends out axons that go to the opposite side. That decussation doesn't have a special name that you have to worry about. Thank goodness, right? Nothing new to worry about there. Okay. But that second order neuron decussates and then travels up through the pons and the midbrain and synapses in a special place in the contralateral thalamus. Okay, synapses with a third order neuron in the contralateral thalamus. Now, does anyone remember what the name of the space where the STT, which part of the thalamus was that? Does anybody remember? VPL, right, okay. But this is cranial nerves, so this third order neuron resides in a nearby space known as the VPN, M. So ventral posterior medial portion of the thalamus. The pen's running out. So this is going to be the VPM, and VPM stands for ventral posterior medial. So STT is in VPL. Cranial nerve sensory resides, the third order neuron is in the VPM, ventral posterior medial. Okay, everybody got it? Okay, there's only one more thing to talk about. These second order neurons, when they decussate, the axons decussate to the opposite side and then travel up through the pons in the midbrain. This is a tract that has a name, and it's named the trigeminothalamic tract. Okay, the trigeminothalamic tract is nothing more than second order sensory neuron axons that are traveling upward on their way to the thalamus. Okay, so all information that synapses here, all those cranial nerves that we talked about, that synapse in the main sensory and spinal nucleus of trigeminal, go through the same pathway, trigeminothalamic pathway. Okay? And then once we get up here to the VPM, this third order neuron in the thalamus, sends out axons that synapse specifically here in the post-central gyrus in the face area of the homunculus. face area of the postcentral gyrus. Right? Because that information is coming from the face. It's up to the homunculus in that way. So, quick recap. Cranial nerves have, sensory cranial nerves have a ganglion. Okay, in this particular example, we're looking at the fifth cranial nerve, the trigeminal nerve. It has the trigeminal ganglion. First order neuron lives in the trigeminal ganglion, just like it does in the dorsal root ganglion for the spinal cord. It sends out axons that travel as part of the fifth cranial nerve and synapse in the main sensory and spinal nucleus of trigeminal. Synapses with the second order neuron. That second order neuron sends out axons that decussate immediately to the opposite side. They travel up through the pons and the midbrain all the way up to the thalamus and synapse with the third order neuron in the thalamus that resides in the ventral posterior medial portion of the thalamus. Go ahead.
Just to clarify, if you have a lesion in the pons or below, it would be ipsilateral, but anywhere above the pons, it'd be a contralateral facial nucleus.
Okay, so I would worry more. So you said a lesion above the pons or below the pons.
Like the pons or below. So if it was like in the main nucleus or the spinal nucleus or trigeminal.
Is that going to be ipsilateral? Mm-hmm. Yes. Exactly. And we'll talk more about that when we get to the motor too. Does everybody see that? But if you have an area up here that was affected, say, by a stroke, in this side, you'd see a contralateral presentation. But when you're having a lesion that's going to affect this side, if this spinal nucleus was affected, then it would be ipsilateral, right? And if the trigeminal ganglion were affected on this side, it would also be ipsilateral. Does everybody see that? Okay, and we'll talk more about that when we get to the motor function as well. It becomes even more important. Other questions? Make sense? Sort of? Okay, and that third order neuron located in the BPM sends out axons that synapse in the face area of the postcentral gyrus, on the face area of the homunculus. Okay. All right, let's go ahead and look at the motor cranial nerve pathway. Okay. This is the motor cranial nerve pathway. Again, just like before, we're going to see some decussation happening, so I'm going to go ahead and put in my dots for midline. Okay. What we talked about before, this is my thalamus, and here's my lentiform nucleus. I'm picking on cranial nerve 5, we'll just stick with him, and I'm going to draw my fifth cranial nerve here on the lateral portion of the pons. Okay, this is going to be cranial nerve 5, and that's trigeminal. Okay, and trigeminal had a motor function. Does anybody remember what the motor function is for cranial nerve number 5? Muscles of mastication, correct. And for muscles of mastication, it's going to use the motor nucleus of trigeminal. So I'll just go ahead and draw that in bilaterally. Okay. Okay, this is going to be the motor nucleus of trigeminal. As I said before, I'm just using trigeminal as an example. The majority of the motor cranial nerves are going to do something similar with one exception. And And I'll cover the exception on the next slide. Okay, so pick your favorite motor cranial nerve, and it's going to be about the same. So you're going to have a neuronal cell body. It's going to be here in the precentral gyrus bilaterally. So you can think of this as this is going to be your upper motor neuron. Okay, present bilaterally. That upper motor neuron is going to send out. Okay, is everybody caught up? Okay, I'm just going to draw this in bilaterally. All right, so this is an upper motor neuron here in the precentral gyrus, and here's my motor nucleus of trigeminal. Okay, there's an upper motor neuron up here on the, let's see, this is the right side, and then this is the left side. Okay, upper motor neuron sends out an axon, travels down through the internal capsule, and is going to synapse on lower motor neuron cell body here in the motor nucleus of trigeminal, ipsilaterally. Okay, and also at about the level of the nucleus, it's going to synapse, decusate and synapse with a lower motor neuron contralaterally in the contralateral nucleus. All right, same thing happens on the other side. There's an upper motor neuron that sends out axons that travel through the internal capsule. Okay, traveling straight on down, going to synapse ipsilaterally with the motor nucleus of trigeminal, and also decusate at about the level of the nucleus to the contralateral nucleus. Okay, so then these lower motor neurons that are part of the motor nucleus of trigeminal send out axons that travel through fifth cranial nerve and innervate muscles of mastication. Okay. Bilaterally. Something you can't read, Kayla? Processing? Okay. So essentially, what happens then, what happens if a person has a stroke that's affected the left side of their brain? Is the function of chewing going to be affected? What do you think?
Maybe
Not. Why? Why not?
because the same information from the inside.
Exactly. It's a redundant system. So if I lose this side, it's going to innervate both ipsilaterally and contralaterally because of that decusation. Okay? So there's going to be, if I lose one upper motor neuron, I still have the function. Okay? What happens if I lose the lower motor neuron? What happens if there's a problem over here, though? Do I lose swallowing function? Do I lose chewing function?
Yeah.
Yes. Only on the right side, though, right? Does everybody see that? So if this goes back to your question earlier about the ipsilateral versus contralateral. A problem here in the cranial nerve nucleus is going to present ipsilaterally. Okay. Does everybody see that? Yeah, Ben?
So if you have an injury to your upper motor neurons down the left, even though it's not causing you to lose function, would it weaken your...
Nope, it doesn't weaken. No change. No presentation. There's only one presentation. There's only one cranial nerve that's going to be unique to, and we're going to talk about that next. Okay, but that's the important point here. It's a redundant system. There's only one more thing, and then we'll take a short break. Okay? I need to give you a name for these tracks. Okay, these tracks are present here bilaterally. Okay, so both on both sides. Okay. Remember the corticospinal tract is going to be the main voluntary motor tract coming from the cortex to the spinal cord, Well, this is going to be the main tract where all the motor cranial nerves travel through, and this is called your corticobulbar, B-U-L-B-A-R tract. Corticobulbar tract. Okay, that's traveling from the cortical region all the way down to the brainstem, bulbar. Questions? Go ahead, Johnny.
Explain one more time how it's ipsilateral.
Sure, absolutely.
What? Or if it's in the cranial nerve, is that what you said? If it's in the cranial nerve, it's ipsilateral?
Absolutely. Cranial nerve damage by itself, and cranial nerves are a lower motor neuron. So your lower, here's your upper motor neuron up here. This guy and this guy, these are both lower motor neurons. Okay. So if I have damage, so anywhere, if I have damage to this nucleus, or if I have damage to anything coming out, do you see how that problem is going to present ipsilaterally? So I've destroyed this and I've destroyed this. Does that make sense? Okay. But if I destroy this, I still have this bilaterally. So I don't change any information. If I have an upper motor neuron lesion up here, it doesn't change the presentation because it's ipsilateral and contralateral synapse. Got it?
It's just if it's in the nucleus or what's going out to the periphery.
Correct. Just like spinal cord. If it's lower motor neuron damage, it's going to be ipsilateral. Okay. We'll hit that again when we get to brainstem vascular syndromes. You'll see some other stuff. Any other questions? Does that make sense? Pretty clear? Sort of? Where we're at, Felicia?
I missed what you said about the corticobulbar tract.
Yeah. So kind of like the corticospinal tract starts up here and goes all the way down to the spine. This is just the name of the tract. It's a specific tract that it's going to travel along with the corticospinal tract, and you'll see it as part of the midbrain. But it's just the name for these axons as they're descending down through the internal capsule and into the brainstem. It's just the name. Corticobulbar for cranial nerve motor nuclei, and corticospinal for voluntary muscles through the spinal cord. Okay, any other questions? All right, let's take a 10-minute break.